Hey everybody, today's video is going to be on physical assessment. So I'm going to quickly go over a run through of how you should do physical assessment. Bear in mind there's some differences when you do checkoffs. It's going to be you and another student. So the student is going to be your patient. And also I'm unable to move the camera, so I'm going to have to talk through some things and you won't really be able to see it that well. But let's go ahead and get started. So we enter the patient's room. We wash our hands, of course. We're going to identify the patient. Hey, my name is Chad. I'm going to be your nurse today. Can you give me your name and date of birth? And you check with their armband. And then you explain to them what's happening. So I'm going to be doing a physical assessment today. And so that's going to involve like listening to lung sounds, asking you some questions. Some of them may seem like silly questions, but just humor me for this, okay? So we'll start, and the way we're going to do head to toe. So on your checkoff form, it's listed by body systems. And if you want to, you can check off like that, but ideally what you would do is rewrite the form and make it go from head to toe. So whenever I do a head to toe assessment, I start at the head and I end at the feet at the end. So I'm going to first start off by asking neuro questions. So can you tell me what your name is? Can you tell me where you are today? And can you tell me what year it is? So if the patient answers those correctly, the patient is awake, alert, and oriented, ×3. So that's within normal limits. Next, I'm gonna check the patient's eyes. Now, of course, this mannequin's eyes are closed, but what I would do is have them open their eyes and tell them to look straight ahead. And I'm gonna shine one light into this eye. I'm gonna come around and shine one light into this eye. The pupils are equal, round, and reactive to light. So we're also gonna do an accommodation test. Can you look far off at the wall back there? Okay, now look at the pen. And I'm gonna check their eyes for accommodation. So they accommodate. So the pupils are equal, round, reactive to light with accommodation. I'm gonna check mucous membranes. Can you open your mouth for me? Mucous membranes are pink and moist. I'm looking at their nose as well. I'm checking the skin to see if they have any lesions, to see if their skin is intact on their face. I'm gonna go ahead and feel the temporal pulses. So I'm going to check them at the same time. Temporal pulses are +2 equal bilaterally. And then I'm going to go to the carotids. I'm going to check the carotids one at a time. Checking the carotid pulse. Okay. And check the pulse on the other side. All right, so the next step is we're going to move on to the chest. So I'm going to have the patient sit up. This mannequin is not going to sit up very well. So I'm going to sit them up myself, and I'm going to start off by listening to lung sounds on the posterior side. So I'm going to ask the patient to sit up. The student that's your patient can sit on the side of the bed, and you can go around the other side however you want to do this, but I'm going to have to just push this mannequin forward. I'm going to listen, take a deep breath in and out for me. In and out. In and out, please. All right, in and out. All right, breathe in and out. Now, since you have difficulty being able to see where I'm placing the stethoscope, what you can do is go to your book, to your textbook, and there's a specific diagram as to where to listen to. But the most important point is that you're hitting every quadrant and you're listening to inspiration and expiration. So while I was listening to the patient's lung sounds posterior, I was also checking their skin to see if it's intact. I'm going to feel the texture of the skin. It's smooth. Is it dry? Is it moist? We want to check that out at every part of their skin. I'm going to move to the front now, and I'm going to listen to the lung sounds anterior. deep breath for me, in and out. I'm going to listen laterally as well. In and out, please. In and out, please. Okay. So, lung sounds are clear, no adventitious breath sounds. Respirations are regular, so we've assessed the respirations, so that's how we assess the lungs. So now we're going to listen to the pulse points. So you're going to have to identify pulse points. I'm going to state their names and where they are, and you're going to have to do the same for your checkoff. So we have the aortic pulse point, which is the second intercostal space, right sternal border. So when you're feeling intercostal spaces, intercostal means between ribs. So where your clavicle is and your first rib, that's not an intercostal space. So you're going to skip that. So there's my first and there's my second. So second intercostal space, right sternal border. So it's going to be right there. All right, and then I'm going to listen to the pulmonic. So that's the opposite side in the same spot. So that's second intercostal space, left sternal border. And then the next one is one intercostal space down in the same spot, left sternal border. That's the second pulmonic, or Erb's point. All right, and then I'm going to listen to the tricuspid, which is the fourth intercostal space, left sternal border. And then I'll listen to the mitral, which is the fifth intercostal space, left sternal border. And then lastly, I'm going to listen to the apical pulse, which is a very important pulse. The apical pulse, we are going to listen to for 60 seconds. So your instructor is going to listen with you, and you're going to count for 60 seconds. I'm just going to demonstrate where it is, but I'm not going to count for the sake of this video. So 1, 2, 3, 4, 5. That's the fifth intercostal space. And then it's left mid-clavicular line. So I'll come down the middle. So it's going to be right here. So I would listen right there. So again, your instructor is going to listen with you with a dual stethoscope. And you're going to count for 60 seconds, tell them the number, and that's going to be your apical pulse. All right, so the next thing we're going to do is do range of motion. So if this is my patient and my patient was able to follow commands, I can say, okay, we're going to do some range of motion tests. Can you lift your arms to your side like this? Can you raise them up, down? Can you do your arms in circles? So if they're able to do that, they have full range of motion in their upper extremities. So now we can move to the abdomen, but actually first let's go ahead and do the rest of our peripheral pulses in our arm. We're also going to check skin turgor. So we're going to pinch the skin. And the skin turgor is normal. We are next going to check the brachial pulse. So the brachial pulse is located in the antecubital fossa. So the opposite end of your elbow, more toward the medial side, toward the middle. So it's going to be right around here. So you're going to find your brachial pulse on both sides. And when we find it, we'll feel for it, we'll palpate, and we will say the brachial pulses are +2 equal bilaterally. We'll also note that whether or not the the arms have any edema. I see no edema in my patient's arms. I'm going to go to the radial pulse now. So that's on the thumb side. Radial pulses are +2 equal bilaterally. I'm going to lay the patient down flat now so that I can better assess their abdomen. This is going to be difficult for you to see. But there's a certain order in which we need to assess the patient's abdomen. So I'm going to uncover just their abdomen. I know you won't be able to properly see this, but what we're going to do is first we're going to visualize. Sorry, that patient had a dressing he wasn't supposed to have. So we're going to first start by visualizing the abdomen. All right. We're going to get down eye level and see if it's distended. The abdomen is not distended. The next thing we're going to do is auscultate. We're going to listen for bowel sounds. So we start in the right lower quadrant, and then we listen in the right upper quadrant, left upper quadrant, and then the left lower quadrant. Bowel sounds are present and active in all 4 quadrants. So that's going to be how we state that. Now we are going to palpate the abdomen. So I'm just going to press down on your stomach a little bit and just tell me if you're feeling any pain, okay? Again, we're looking at the skin at every point to see if it's intact, if there are any lesions or abrasions. Skin color is appropriate to ethnicity. And of course, if the skin is pink, okay, so the patient denies any abdominal tenderness. Now, while we're here, first we can cover them back up, but what we want to do is ask them some questions about their bowel habits and their urinary while we're thinking about it as well. So, can you tell me when your last bowel movement was? What day it was? Was it today, yesterday? Once the patient tells you that, say, can you describe for me what your bowel movements are usually like? Are they formed? Are they loose? What color are they? And the patient can respond appropriately. And you may need to ask follow-up questions. How often would you say you have a bowel movement during the week? All right, and then we're going to move on. Do you ever have any accidents where you can't make it to the bathroom on time when you need to have a bowel movement? And if they say yes, if they have accidents, that means they're incontinent to bowel at times. They're continent to bowel if they can make it to the bathroom on time. We're going to ask very similar questions for the urinary system. So how often would you say you urinate in a day? Can you tell me what color your urine was the last time you urinated? Can you tell me, do you ever have issues with making it to the bathroom on time? These things can also be assessed by visualizing their bowel movement or their urine. So we may have to do that as well. And so another thing that we're going to do, if necessary, is palpate the patient's bladder. So for checkoffs, you can just pretend we don't need to touch each other where your bladder would be. So you can just pretend, okay, I'm palpating the bladder. And then you can state bladder is not distended, and that would be normal. So I'm going to move down to the feet, and I'm going to uncover the patient's legs from the bottom because I don't want them to be cold, and also because I want you to be able to see. So let me uncover the patient here. Oh, somebody left. Oh, they're comfortable with a pillow and everything. Let's keep them as covered as possible. So we're going to check to see if the patient has any edema in their legs, any swelling. No edema noted. We're going to find their popliteal pulse behind their knee. Popliteal pulse is +2 equal bilaterally. Check the skin temperature, which we're going to do as well throughout the body. So skin temperature, we're going to describe that: warm, cool. We're going to check range of motion. So can you bend your knees for me? So get the patient to bend their knees. Get the patient to bend their knees for you. Bring your legs together, spread them apart. And so that will be adequate range of motion. So you can say full range of motion in lower extremities. And then we're also going to check dorsiflexion and plantar flexion. So we're going to tell them, can you push down on my feet, on my hands with your feet, like you're trying to press down the gas pedal, and then pull back. And when they do so, we will say that dorsiflexion and plantar flexion are strong. We are going to check capillary refill. So we're going to check. We're going to press on one of their toenails. Capillary refill is less than 3 seconds, which is normal. We'll also feel their posterior tibial pulse, which is near their ankle. Those pulses are +2 equal bilaterally. And then the last one we want to feel is our dorsalis pedis, or our pedal pulse. And that's going to be between the first and second toes, midway up the foot. Those pulses are +2 equal bilaterally. You can always go back and do later. For example, I did not check hand grip strength, and I did not check the capillary refill. So I'm going to go back to my patient and say, okay, I have a couple more things to do real quick. Can you squeeze my fingers for me with both hands at the same time? All right, squeeze them for me. Okay, thank you. So her hand grips are strong. And then I'm going to take her fingernail, and depress and check capillary refill. Capillary refill is 2 seconds, which is within normal limits. All right, so that's going to be everything for the assessment. So what we want to do now is we're going to lower the bed into the lowest position. So we want to lower the bed until it won't lower anymore, and that's for safety. But while I was assessing the patient, I had the bed higher up because I don't want to hurt my back leaning over constantly. Are you comfortable? You want your head up a little bit? All right. And then you would also get the patient's call light and put it in place, which we don't have one on this bed, but you could give them the call light, make sure it's close, ask them if they need anything else, and then you're finished, and then you're going to go chart. So as you perform the assessment, one thing that's important is to make sure that you know how to state what something is. If you listen closely, I mentioned the majority of how you need to state things. For example, lung sounds are clear. Vowel sounds active in all 4 quadrants, for example, is another one. Respirations are full, regular. Breath sounds are clear. The bilateral pulses were +2 equal bilaterally. So you need to learn how to state things. And if you have a question right now about how to state things, then just ask one of us and we can explain it to you. I hope this helped. Feel free to ask questions if you see me, and we'll help you get this figured out. Have a good one.